starting.
All right, hello, I'm Nurse Monday, and I wanted to do a presentation over that's related to the clinical setting that I am in right now, and that's school nurse. I was working with my preceptor, and a kid came in that had asthma, and the child wasn't suffering from an asthma attack, but she was getting treatment. So I asked her, like, how often do you see asthma attacks? And she said, you know, at this time of year, usually they're pretty often. And she was surprised that we hadn't seen more, being that it was the middle of flu season and the weather was cool in the morning at least, even though we hadn't had a traditionally cool fall as of yet. But this is normally when they see when the air is dry also. So I decided to do something that would benefit that setting with this PowerPoint. So I'm going over a decreasing asthma attack. I'm going to the PowerPoint. Decreasing asthma attack with asthma action plan. So that's what I want to talk about. And the reason why is because it allows students to have fewer emergency hospital visits and school absentees. Next slide. Why am I proposing this? There are a lot of ailments that children suffer from that keep them out of school. By implementing asthma and action plans as a requirement for students, it would create a safer environment for children with asthma at least. Of course, there's other ailments out there. But the number one reason is because emergency room visits and school absentee can also be decreased. And a lot of times when a child is in the emergency room or in the hospital, a lot of times they're going to miss school following day after that, probably because they're kept in the hospital, in the emergency room all night, the parent is tired, and it kind of trickles down from there. Okay, I'm going to my next slide. Here's a little proof of the action plan working. Now, this may not be a significant reason for decreasing, but there is a reason nonetheless. 24% of patients who had an action plan visited the ED, whereas 28% of those who did not have an action plan. So there is proof that there is some difference in having an action plan and not having an action plan. So if we can only get 2% difference, it's worth it. A fact about asthma. I'm not going to read the whole slide, but asthma is the leading cause of school absenteeism, which is one of the reasons why I said that I wanted to promote this. Children with persistent asthma are more likely, 10 times more likely, to be absent from school and have at least 10 days missed from school. That's a lot of absences just based on asthma. We're not even counting the days that they may have a stomach virus, which is coming in school, that they may have staph infection or earache sore, or, and of course this is for the younger child usually, or a flu or anything like that. This is 10 days just related to asthma. Asthma attacks is an emergency. It is not something that we can sit and wait on like a child waiting for their mom to pick them up from having vomited at school. A child is at school 8 hours of the day. More than likely, if an asthma attack occurs, it is going to occur within the school. So we have to have the staff ready. How are we going to get them ready? Let's go through a case scenario. I'm not going to read this word for word, but you can follow along. John is 8 years old. He has been playing on the playground at recess. It's a cold day, but a clear day. John has been noticed participating in racing with some of his friends, and then all of a sudden he's not racing as much. Now, after the races, he was coughing, and John was noticed sitting on the merry-go-round by himself with his hand placed over his chest. Now, Miss Logan, his teacher, was noticed that he was no longer racing and went over to see what's wrong with him. Noticed the change in him, and he was breathing rapidly and wheezing. Of course, anybody could, most of us know what wheezing sounds like. She immediately notified the nurse. The nurse comes out. It takes her 3 minutes to get from her office to John on the playground. Now, when Nurse Lewis arrives to the playground, she noticed that John has changed color. His O2 status is now 85%. Now, Nurse Lewis is administering the emergency treatment that she knows and has called 911 and told the teacher to call John's mother. Now, what could have been done differently? Not saying that they handled the situation incorrectly, but you'll see where action plan comes into this and where we can go backwards a little bit and may do some prevention. The action plan, what can it do for us in this situation? Insurance staff is aware of the child's asthma. Did everyone on that playground know that John suffered from asthma in the first place? Was staff aware of the student's triggers? Did they know what triggers his asthma? Were they familiar with him? did they know the symptoms to look for before John got into a situation where the nurse needed to implement a 911 treatment, 911 emergency to come out for him? Could they have noticed those symptoms sooner? Now, in the end, I'm going to go back a slide. The nurse notified 911. She did the right thing, because at this time his O2 status less than 90%, and the guy and this little boy is changing colors. So, but if we go back, I want to pull some things out of this scenario. If we go back, if we have an action plan in place, some of these things are brought out to us, even for those who are not in the medical profession. He's a young boy, so he may know some things about his asthma. He may not. Some kids are just naturally shy and won't say anything even if they know. So it's not. Some are reliable and some are not at that age. We look at that as cold outside, but it is a clear day. Despite the fact that it's clear, we talked about cold being a trigger for asthma for some kids, or most kids. John was coughing right after the races. This is a good time to start implementing some treatment, or to maybe look after John a little more closely so that we wouldn't get into a red zone. And I'll talk about zones in just a minute. And then we notice that he's breathing rapidly and he's wheezing, and the nurse calls for 911, and he's off to the hospital after the treatment. We're going to assume that the treatment did not work. He's off to the hospital because we're doing the worst case scenario here. Okay. And I'm going to go forward, another slide. This is an example of an asthma action plan. This is what it looks like. As you can see, it's broken down in our color code: green, yellow, and red. The green you see is where it says you're doing well. This is where you want to be, just like traffic lights. It's easy even for a kid to follow. You're doing well. This means this kid is not showing you asthma. He's breathing good, no coughing, no wheezing. He's sleeping well at night. So of course, some of these things will cause for the parent to be encouraged to give information as well. It has a list of medications there: Singular, Flovent, Pulmicort. These should be routine medication. If he should not need any rescue inhaler here, just as routine things. Now we go down to, this is where John in our scenario could have started. This is where we could have looked at to make sure he got those things before he came to school that day. Now down into the yellow zone is where I say that John was coughing. John was coughing on the playground after he ran. That's out in his caution under yellow zone. First signs of a cold. He didn't have a cold. Mild wheezing. I'm sure the wheezing could have been mild before it got to the point where he was in the rescue status. He had a tight cough. And then it's got a list of medications to sign here that are listed here of what needs to be done there. Albuterol 2 puffs with spacer. And these are things that are picked up in conjunction with your doctor. Increased Flovent, call office, and all that. And the parent can put in things that they want. Does the parent want to be notified, or a caregiver wants to be notified? And last, we go down to the red zone, and this is where the nurse implemented her emergency treatment. And I would say if she implemented an albuterol treatment, maybe one, then 15 minutes right after one unit right after the other, and that didn't work, and then we go to the emergency room to save the child. But that is a basic and simple step-by-step. And also there's some like this one here, that gives you, is a quick reference guides for patient information on there too. And these can be put in the office, put in the child's book bag, put in the lunchroom. They can be kept almost anywhere, but they're very beneficial for that child and his care. Okay, we'll go to the next slide. Oh, don't pause, don't pause.